But I think this will be informative, and I hope that we can actually make this interesting for you and make sure that it is useful for you. And I also want to thank the Foundation for allowing me to have the opportunity to share this information with you, as well as the CEO of the Hospital Marshall Hall. Again, one of the things that I want to talk about is we actually now are looking at ways of minimally invasively performing surgeries. And so there's a lot of people that will market minimally invasive surgery, but there's many different ways to do it. It's not just in the sinuses. That's one of the reasons why I went on with the robotic surgery as well. So when you're looking, you want to make sure that somebody is not just using it as a marketing term, but really has the philosophy behind it. My biography was already mentioned, so I won't really belabor this too much, but I have seen over 20,000 patients, as well as 3,000 surgeries, and then more in many other aspects of general ENT. I did also do a fellowship in otology, neurotology, skull-based surgery, and I also do pituitary tumors with neurosurgeons as well. So I just thought that that might be something of interest for some of you. This is the front of my web sheet. Again, it's www.plainent1word.com. There's a wealth of information that is at the website, so if you don't get all the information here, what I want you to do, if you do anything else, if you visit this website, is look at this health library section. I put this on there because I wanted to help promote health. So if you do nothing else, look at the health library section, because there's a lot of information outside of general ENT that you can look to see and get a little bit more information that I think would be very helpful for you. This also gives you some information about the minimally invasive sinus surgery, and again, also the Da Vinci robotic surgery and the transoral robotic surgery. Now on to sinusitis overview. This is a large problem in the United States. Over 37 million people are affected each year. There's different various ways that the sinuses can be involved. There's acute sinusitis, there's acute chronic sinusitis, and there's also chronic sinusitis. You're not interested in all the names and definitions. You're interested in pain, the suffering. You're interested in relief. Okay. What are some of the signs and symptoms? Well, you can have nasal congestion. You can have facial discomfort. Usually the facial discomfort is in the area of the frontal sinuses, the ethmoid sinuses, the maxillary sinuses. But one thing that people don't really know, and even some of the medical students and even primary care doctors don't know, is that sphenoid sinusitis can refer pain as well. But the sphenoid sinus refers pain right to the capitulum, the vertex of the head. So some people actually have headaches that are up here, and they go to neurologists, and they are improperly diagnosed. So I think that's just something that you should really understand about the sinuses. In addition to the headaches and the nasal discharge, the facial discomfort, you can also have upper teeth problems. It's usually the maxillary sinuses that cause that. So if you have a maxillary sinus or a cheek sinus on this side and you have pain in your tooth, it can be one of two things. It can actually be coming from the tooth, causing the inflammation, or it can actually be from the sinuses causing inflammation on the tooth. If you've already gone to your dentist and he's already done films to take a look at that, that may be helpful to look at that. But if you're still having issues and you've talked to your dentist and there is no problem with your teeth, you might need to see an ear, nose, and throat physician as well. Just parenthetically, yesterday I did a transoral robotic surgery on a patient who had a large palate tumor that was eroding into the sinuses, which actually did cause a large polyp in the maxillary sinus, and it was blocking her left maxillary sinus, and it was also going down the back of her nose. And I had to do the sinus surgery as well. So again, it can either come before and it can come after. Now, facts about chronic sinusitis. It's more prevalent than heart disease. It's more prevalent than asthma. It can have a great impact on your quality of life. I didn't really mention it on the last slide, but believe it or not, chronic sinusitis can cause a lot of fatigue, and I see it with a lot of patients. How does it do that? Well, think of your body as having a power plant. It has to divvy up its energy. It has to decide where its resources are going to go. Kind of like your checking account, your bank account. You have to decide what's important. If your body is fighting an infection, it has a certain amount of resources that it has to allocate towards fighting that infection. that's less resources dedicated to other things that you may prefer to do and enjoy and make your life a higher quality level of living. So it does have a great factor of contributing to your inability to enjoy life to its fullest. And it can actually lead to chronic problems with your psychological aspects of your life. If you're not feeling well, one thing we know is that chronic pain is actually worse to have than acute pain. It's like the Chinese water torture. If you just have drip, 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 and you have no control over that, you have lost the ability to feel that you have control. So what ends up happening is that really lowers your quality of life and depression starts. And so you're really affected emotionally, not only from the standpoint of the infection, but also your emotional capital is also being partially spent and is actually going into other resources. So as you can see, chronic sinusitis, and we're not talking about acute sinusitis, just chronic sinusitis, is estimated to affect 18 to 22 million people, and they go for visits. So what are the roles of the sinuses? Why do we have sinuses? Well, one of the theories being is that they lighten the head. Okay. Bone can be very heavy and dense, so that's one of the things. The other things is they're resonators. They actually give us the ability to have our characteristic pitch of our voice. They also have a mucous ciliary layer that actually cleans out so that you can maintain this space. Now, when the sinuses are plugged, then what can happen is you can have essentially what's the equivalent of a stagnant pool. Imagine if you have a pool or you go to a pool, imagine that the pump breaks. Okay. If the pump breaks, what happens? You see algae grow. Okay. So you have to have a filter. Now, if it can't pump and it can't go through the filter, then you have more and more bioorganisms that are growing. Okay. So you can fix the pump, and you can fix the filter, or you can try and throw lots of antibiotics and other medicines to help improve your sinuses. And so that's what I would give to you as a model. A lot of times the antibiotics, what they're doing is it's like throwing chlorine into a pool. Okay? Antibiotics or the chlorine, think of the bacteria as the algae, and the sinuses the swimming pool. So again, in order to have a good quality of life, it's really important to make sure your sinuses are actually functioning properly. So if you do have sinus problems, what are your options? Okay. Well, there's many different things that you can do. One, you can actually use sinus irrigation, saline irrigation, medicines, there's surgery. So what you have to find out is what is right for me. Okay, because as I alluded to, there's chronic sinusitis, but chronic sinusitis just means that there's a chronic inflammation. It doesn't tell you it's always infection. I have another patient who actually has had chronic sinusitis nasal obstruction, but he turned out to have a rare tumor, malignant tumor. Okay, so a lot of times people think that chronic sinusitis is nothing to really look at or to take care of, but they are. It's not just infections. Now, certainly treatment for chronic sinusitis with regards to taking care of an infection is one thing. However, again, if you have a tumor that's obstructing an infection, getting rid of the tumor will actually also help get rid of the infection, but more importantly, you prioritize and take care of the tumor as well. So I think it's really important that you do visit your doctor to find out if you're having chronic sinus problems. I'm not talking about your acute colds. I'm not talking about your viral illnesses that just last for a week. But if you have chronic sinusitis that lasts for weeks to months, then you really need to get that evaluated. Make sure there's nothing more serious that's going on than just an inflammatory process and infection. You also need to make sure there's no tumors there.